You are watching the DocTalk show.
So in this era of social media, where a patient contacts you on WhatsApp, on Facebook, so you receive all these texts and she expects you to actually do antenatal clinics on phone.
Dr. Jaffa, Dr. Billy, someone gave me your contact. I think I'm 5 months pregnant, I'm 2 months pregnant. What can I take? What can I do? What can I take? These are the common questions.
Yes.
What medicine can I take? Do I need to come and see you?
We can't run it from social media.
Yes.
It's us to make it like a formal way of making appointments.
Of helping
These clients. If something we need to examine your patient, you have to make an appointment. Like, okay, please, can you come?
And every
hospital?
patient needs to be examined. You can't be treated on phone.
If it were a one sentence, a one statement answer, you'd probably tell someone, advise them do this. But this is a very long journey that you're going to take someone through. So you need to sit down and tell them exactly.
You can miss some complications.
Exactly.
People are taking scans to be their doctor.
Oh, yes. I went for a scan, I did this. So I think...
someone is coming to see you 2 months.
The scans are taking our work.
Exactly.
And even as doctors, we are no longer doing any work. Abdominal pain, scan.
I want to know the sex scan.
Someone comes 2 months pregnant and they've done 4 scans already without...
What are you looking?
But I think most important, that is why people need to know now what to expect when they come for antenatal care. How many scans they should do, what tests they should be expecting, because we have routine tests that we do and we have extra tests that we do for mothers who are high risk.
Sure, doctor. Because when you come for antenatal, your health provider should take you through a couple of things that you need to do. Some of them are routine, that you must do them, whether you have a problem or not. And commonly, we take you through a couple of tests.
Some of these tests, you need to do the hemoglobin estimation.
The blood level.
That's from the amount of blood level you have.
Yes.
We need to do your blood group.
Yes, because your blood is very important, especially for...
Might need a transfusion. You have heard of that story whereby the hemoglobin, the blood group was done in one hospital, and then the time of transfusion, they had the wrong blood group, so they never cross-matched again. They transfused that blood. And the case ended up with a maternal death, and I think it's still running in court. Yeah, so it's very important to know your blood group.
Right from the beginning of pregnancy, so that at the point where if it's an emergency, then we know what blood to transfuse.
True. There are common infections, very common, prevalent in Uganda, and some of them are even on the high, hepatitis, especially B. HIV has been with us for a long time. Syphilis has been with us for a long time. So these are infections that people carry and can easily be transmitted
to the baby. So we do those tests during
very
antenatal
prudent
care
to know them.
to ensure that
you can treat.
Yes, they can be managed to prevent the transmission to the baby.
Exactly.
And of course, also during the antenatal care, we take a detailed history to know where you're coming from, to understand your medical conditions, if you had any medical conditions, your age, and all those details to help us assess and plan for you.
We often also check people for diabetes, especially in the second half of the pregnancy. We commonly check their urine because that is a common occurrence in pregnant mothers.
So if I may, because most women actually wonder why we check for blood sugar and diabetes, because they say, I've never been diabetic, we have no family history of diabetes.
Pregnancy itself exposes people, puts them at risk of developing diabetes. Pregnancy
gestational diabetes mellitus.
Yes, a sole condition.
And that we call gestational diabetes.
Exactly.
So it comes when you're pregnant, and you didn't have it before and after your pregnancy.
Yeah, exactly. And then the urine, commonly infections, as pregnancy itself, it will predispose you. Mothers are going to tell you, I went to a toilet in Chikubo, maybe that's where I picked the infection. I have this pain, I go to the toilet more often.
You always ask them, explain exactly
what you're feeling.
Others, mothers say, I think I picked an infection. And
the mix-up
but pregnancy, I think what people need to know is that pregnancy in itself lowers your immunity. And then you are able to you end up picking up infections faster than other people. And that's what you're talking about, Dr. Jaffa, of the urinary infections, the urinary tract infections, themselves can cause a miscarriage. An untreated urinary tract infection can cause an
The mix-up, what I commonly say is the mix-up between a urinary tract infection and a vaginal infection. When someone has a vaginal discharge, yeah, they are going to commonly call it a UTI. I have a UTI, I have a UTI. So there's a
and even some end up with the self-medication.
Exactly, we need to keep, you take an antibiotic for maybe a normal vaginal discharge that someone is not aware of.
But I think people will kill us if we do not talk about scans, because in Uganda, every pregnant woman does scans like as often as they eat food.
Scans are very crucial, very, very important, and we encourage mothers to take scans. But routinely we advise a maximum of 3. Someone can do more if there are various indications to do scans, but we usually advise 3. You need 1 in the because the pregnancy categorically we split it into 3 phases, what we call trimesters. Yes, every 3 months, the first 3 months, middle 3 months, and the last 3 months. So at least you should do a scan in each of those trimesters. But the first scan is very, very important.
And of course, it's very important for those ones who have had problems with their periods, because we know that there are some mothers who have issues with their periods.
The ones who come when they don't know that they are pregnant.
And those ones who have been on family planning, because we know some family planning methods make you not to have your menstruation. So those ones need those early scans. And of course, anyone who comes the first contact.
Yeah, because you need to estimate at least how big your pregnancy is. Yes, you've had so many issues. Someone doesn't even, okay, my sisters forbid, but some people don't know who the father of the pregnancy is. They are going to use the scan to help them. I think I was with Tom the other day. Then if this scan tells me...
I thought the scan will show the baby's face looking like
no, if the scan is telling me my baby is 2 months, then I can work backwards. Yeah, sure. We are not encouraging that, but scans will tell you.
The early scans will
tell us
that
will help
estimate
you closer to a scan that you will do later in the pregnancy.
And very good point, because women come even at 30 weeks, at 6, 7, 8 months, and they're still saying, now you see the scan dates have changed.
Yes.
And they're using the dates at
very
8 months.
puzzling question. They have 5 scans. Doctor, each scan I do is giving me different dates. That is expected. And the dates might change.
But one thing I think that women need to know is the fact that the most important date for us is the date of the last normal menstrual.
The first day of the last menstrual period.
Exactly.
That gives us a very good estimation of when you will deliver compared to the scans that we take.
But even the early scans we do, they solve that puzzle.
Yes.
When for example, some mothers will have what we call prolonged pregnancies, which go past the time you expect to deliver. And you want to use a scan to know, should I intervene or not? So the confusion comes when you don't have any. The patient is before you, no scan, no nothing.
And they are in late pregnancy.
Yeah, we would encourage, going forward, we really encourage every woman in their reproductive age to at least keep track of your periods. There are so many applications.
Yes, now the phones have given us apps that you can just...
For so many reasons. It can even be used as a family planning tool. If you understand it well. So keeping track of your period is very important. Apart from knowing the age, you need to know whether the pregnancy you're carrying is actually alive.
Or normal. Because some, you have a baby with no head, you have a baby with no legs, you want to know.
The first few months, you need to know whether you're carrying more than one baby.
Yes.
The number.
You've had cases where pregnancies go into the tubes. You need to know where it's in the right place. So the first scan is going to help you.
It's crucial to...
Exactly. It's going to see all those things. So before you make 3 months, we encourage you to do that very crucial scan.
And then we have the second scan, which is in the second trimester, ideally.
Yeah, ideally we usually count in terms of weeks, 20 to 24 weeks, roughly 5 to 6 months.
Anatomical assessment to assess whether the baby is fully developed without any other complications,
exactly.
Abnormalities, I would say. It's a very important scan.
The most important aspect, medical aspect of that scan, as we are trying to see if your baby is anatomically developed. Do we have all the limbs present? Do we have a heart there on the right side, on the normal side? Do we have
kidneys,
the
liver?
Do we
of
have
course, we pick out those abnormalities that are not compatible with life. There's some abnormalities, you think they are compatible with life? Of course, with difficulty after delivery. Extra digit.
Like an extra finger.
Some things
an extra finger.
But of course, there's some gross abnormalities that you see that even if the baby is delivered,
won't make it, or even the pregnancy will not make it to
the time of delivery.
And then one of the last scan that we normally do at the end of a pregnancy.
That one has caused problems with the cords around the neck. Around the neck, doctor, will I be able to push?
And there have become indications of cesarean sections and cesarean sections.
And that's the reason they're blaming us, the gynecologists, that we've made lots of money because of the cords around the neck. No, I don't think it's true.
In recent practice, actually, it's not even advised to report about the cord. Unless there are different versions of complication of the cord. If it's making a knot somewhere.
Yes, if it has, it's very tight around the neck.
The mother comes with a complaint. For example, my baby is not moving, kicking the way I'm expecting. Then you find a cord which is tight. Then you can act on it. But the baby is kicking properly and everything is fine. Then, and you know, people who make these alarms, are the sonographers.
Who do
the actual, they're the ones who say, you go back to your doctor.
But if you remember,
it's not good. But of course, we are here.
But if you remember how many women actually deliver normally with a cord around the neck, and the training is that once the head is out, put your hand around the neck because they are, and pick the cord. We expect it. In fact, we get surprised.
So it's not going forward. It's not a routine indication for other operations. Exactly.
Yes.
You have to tie up so many things before you offer.
In a country like Uganda, where we have malaria throughout the year and at high levels everywhere in the country, every mother must be given malaria tablets to prevent malaria, because malaria
who are allergic
to
the drugs we use.
Because once malaria crosses the placenta to the baby, and once it has crossed over, that is a very dangerous situation.
Okay, it does not entirely stop you from getting malaria. If you continue exposing yourself to the mosquitoes, the malaria will
You lower the risk at least when
exactly. You lower the risk and you lower the chances of having the complicated form of malaria.
And of course, the issue of folic acid. You need to take folic acid. Ideally, should be taken before even you conceive.
To prevent
the perinatal.
We are preventing because now we see many
problem with the
spinal
spine,
cord
which are called the
and
neurotube defects.
brain,
So you need to take, but of course now people are taking these, what are they called?
Pregnacare.
There's a Pregnacare Extra, there's Pregnacare with Omega. So
the more money you have, the more.
Yeah, each one has this different cost. But the most important thing here is folic acid.
Folic acid.
And maybe
very
the iron.
Cheap, very cheap and free in government hospitals and highly accessible everywhere. Dr. Jaffa and Dr. Billy will be back to tell us about these high-risk pregnancies that we are finding a lot in this country and in our settings. So see you soon.
You are watching the DocTalk Show.